But first up tonight, Bill English, the Minister of Health. We finally tracked him down and we had 5 questions that we really wanted to ask him. First of all, how is he going to provide free health care to under 5s?
Hard bit there is negotiating with the doctors because it's to do with the way the government pays them for seeing children. So we're making some progress there. Traditionally, this has been a real big battle between the government and the doctors.
Is it because of the increased paperwork that they have to do to get these subsidies?
Well, no, they're just very keen to reserve the right to charge people. And so on the one hand, they want to reserve the right to charge people. On the other hand, the government wants to be able to say to the mother of a 5-year-old, you can be sure when you go to the surgery that the visit will be free.
Big battle on his hands there. And another big battle is that now cheese, which have always been putting a lot of emphasis on profit, are suddenly non-profit. We ask about that.
The main point there is that people mistrust your motives. If you're working in a hospital and you tell them they should be able to go home now, they think that's because you're trying to make money, and then they write a letter to the local Member of Parliament or the Minister of Health.
Feeling they were kicked out early? Or
feeling they were kicked out early for the wrong reasons. And I think that people will accept a lot of things if they believe they're done for the right reasons. So we're taking the profit motive out of the system. That doesn't mean there won't be changes, that there won't be restructuring, that there won't be that there won't be alterations in services. But it does mean, I think, that the public will be more trusting of the motives, that things are happening because they're for better services, not for more money.
Isn't it not just because it didn't work? But they couldn't. First of all, they couldn't make a profit.
Well, we've got to resolve that problem anyway. I mean, these things aren't even breaking even; they're losing a lot of money. So whether they're profits or not for profits, we've got a lot of work to do just to get them to pay their own way.
Would you have been happier staying with the making hospital showing a profit in cheese?
Well, I think the issue of whether the public trust the system is actually more important than almost anything else, because it's their system. And I've been persuaded that it's the right thing to do. I wouldn't have gone out to do it, but having listened to the arguments, I'm going along with it, and I'm the minister who's got the responsibility to put it in place, and we want to do that as soon as we can.
There we have it, a New Zealand first-driven policy that's now on the top of the list for the Minister of Health, turning cheese into non-profit organisations. We asked him about the whole concept of competition and tendering out between cheese.
The sector's been a bit silly about it. They've done quite a number of things that don't make sense simply to try and have competition. Now, what we're saying to them now is we're not trying to create competition for the sake of it. It will exist where it should. But where it isn't, we want you to work together, not compete with each other.
Would losing the public health services at Southern Health, would that be an example of tendering that worked against the situation?
Well, it's a good example, because up in Canterbury, West Coast, Timaru and Christchurch Cheese got together and they formed one group out of all their public health services. And I launched that the other day. The staff in it are very keen, they're performing a lot better already, and they're really looking forward to taking control of their own organisation. Now, that is a more constructive way to achieve the same ends as
and losing little bits of your service to someone else.
Yeah, as the process that went on down here. It happens, if Southland and Otago Cheese got on better, they might have resolved it with a lot less mess.
And that mess, of course, was the way public health services were lost from Southern Health to Otago. The second big area is whether cheese are going to be absorbed or amalgamated. We asked the Minister of Health again.
We're not going to be drawing lines on a map and just saying, well, there's 23, we're going to make 14. For the reasons that I think will be pretty obvious to Southlanders. If we try and jam Southern in with Otago, it won't work.
Why was that?
Well, it won't work because of the tradition of parochialism, the rivalry that's existed between the people and between the hospitals.
Couldn't you put the heat on there and solve that for the interests of the patients?
Well, you could. It's just that we've got more important things to do. What we should be putting the heat on is getting them to provide high quality services and more of them to the people. If it happens that the way to do that is to work with each other, then that could lead to a merger, but they could start just by talking to each other. If we can get them talking to each other, that will be a big step forward, and once they've started talking, then maybe we could think about a merger. But it's a bit like an arranged marriage between two people who hate each other. It's not likely to work that well for a start.
putting it very succinctly. And the final issue, of course, with the ophthalmological row, remember how Dr. Silver was going to be brought in from overseas to help our waiting list on ophthalmological operations. That was canned. The Minister, earlier on, before this piece, has been saying that there's going to be a whole series of procedures put in place, and then he drops the big one.
The way the system currently works is just about protecting the interests of existing surgeons and doctors. Now that's a matter which comes under the Commerce Act, which is all about making sure people don't rort the system for their own benefit. The other issue that will come out of the inquiry is whether or not there is a case for looking at it under the Commerce Act. That is a much more serious matter.
Are you talking about charges possibly here?
Well, probably not. I don't know, because I don't know exactly how the Commerce Act works, but it would be a matter of national significance, really, to have some sort of test case.
Well, there we are. Southern Health setting up a test case for the whole of the nation as whether we can go outside New Zealand and get people in to help us with our waiting lists, and we eagerly await the results of that, as we also eagerly await the man who can actually work this machine.